to AV1 Express. I'm Vivian Akinyosui. On the show today, we'll be taking a look at the just concluded All Africa Medical and Wellness Expo, which came up right here in Abuja. We'll also take a look at some sights and sounds of the city, and then we'll go all the way to Lagos, where we'll bring you economy and business news right here on the show. Don't go away. Welcome back. We're at the Nikon Luxury Hotel right here in Abuja, where the All Africa Medical and Wellness Conference came up. The event focused on the theme, Developing Sustainable Medical Tourism for Nigeria. We'll take a look at highlights of that story. Stakeholders in Nigeria's health sector have urged the government on the need to adopt a holistic approach to harnessing the potential benefits of domestic medical tourism in the country, while also considering how international organizations can contribute to this endeavor. The call was contained in a communique following the just concluded All Africa Medical and Wellness Expo, which came up recently in Abuja. The event, which brought together professionals from both the health and tourism sectors, focused on the theme, Developing Sustainable Domestic Medical Tourism for Nigeria. Minister of State for Health and Social Welfare, Honorable Tunji Alausa, who was represented by his senior technical assistant, Dr. David Atuwo, emphasized the need for collaboration among stakeholders, one he identifies as a holistic approach to improving healthcare services in Nigeria.
In recent years, we have witnessed a concerted effort by the government, private sector, and international partners to invest in healthcare infrastructure, develop the training and retention of healthcare professionals, and strengthen our health systems. The National Health Insurance Agency has been expanded to provide more comprehensive coverage of services, and we continue to explore innovative financing mechanisms to ensure that healthcare is accessible to all Nigerians, regardless of their socioeconomic status.
If you ask any Nigerian about their understanding of medical tourism, they will simply say medical tourism is all about traveling abroad for Medicare. This school of thought has narrowed down medical tourism to outbound medical tourism only. While the real concept of medical tourism encompasses both intrabound, inbound, and outbound medical tourism. When we are talking of intrabound medical tourism, it's also known as domestic medical tourism, and it has to do with traveling from where one is residing within the country in the quest for quality medical treatments. It may be from one local government to another within the country, and it may be from one state to another within the country. And we'll talk about inbound medical tourism. Inbound medical tourism has to do with people coming to your country, from another country to your country, to receive quality medical treatments. And we'll talk about outbound medical tourism, which is the household name in Nigeria, the most popular aspect of medical tourism, which has to do with traveling overseas for Medicare. Many of our local healthcare service providers, they don't want to hear this, including those at the helms of affairs. They don't want to hear this. And it's because of one reason that they don't want to hear. What is that reason? It's because of what we are losing to outbound medical tourism year in, year out.
Dr. Yemi Johnson, who delivered a paper on the journey so far for the Nigerian health sector, emphasized that in the last 15 years, there has been a steady rejuvenation in orthopedic practice, with subspecialization in areas such as invasive cardiology, interventional cardiology, closure of holes in the heart, surgically and non-surgically, open heart surgery, and more.
In every specialty in the US or UK, every specialty, if you count 10 top specialists, 5 will be Nigerians. So we have the people, we have the mental capacity, we have the abilities, just we haven't been able to do it back home for a variety of reasons. We are not where we should be, but we have come a long way over the past 20 years, a long, long way. And many people do not realize what is going on in Nigeria. Many people don't. Things have improved. We started doing internal fixation of fractures. Screws became available, a few hip replacements. But now, we're doing hip and joint replacements, both in the public and private hospitals. Spine surgery, limb lengthening, arthroscopic surgery, complex trauma, pediatric orthopedics, hand surgery, and now orthopedic oncology. So you can see we have moved in great strides with orthopedics. We've done very well there. So many of the things that we used to go abroad for are now present. What are we doing in 2023 in cardiology? Invasive cardiology, for those of you who don't know, that's where we actually go into the body through the arteries or through the veins, and then we open up blockages, put pacemakers, put something called ICD, which is a defibrillator that shocks you, stops you from sudden cardiac death if you're at risk. CRT is a complicated procedure for heart failure. We have started closing holes in the heart, both open heart surgery and non-surgically through this what I would call minimally invasive procedures, which we do now. And I remember we did 20 when I first came back. And Lagos State sponsored all those 20. That was during Fashola's time. Sponsored all those 20, and that's how we started the program. Now we're doing open heart surgery. There's bypass surgery going on, valve replacement. There's aortic aneurysm repair going on now. So I can tell you without any equivocation that as far as cardiology is concerned, the only things we don't do yet in Nigeria are heart transplant and the artificial heart. Everything else is available here and at a high level. But what are the limitations? And these limitations apply to every subspecialty. Almost everything we use is imported. Then one of the most expensive things we deal with is power. Power is expensive. It is very expensive. It is 30% of our cost in any hospital. You have to first buy the generators, then you have to buy diesel, then you have to repair, maintain, and do all these things. Then inverter, UPS, all these things that are not needed in the US. You buy your equipment, you buy your equipment. I remember the budget general last year it said, the surprising thing is we think there's not enough money in healthcare, but we still return about 20 to 30% of the money unused. So it's a question of efficiency, bureaucracy interfering with things. So when you are more efficient with your funding, you can do a lot of things.
Key discussions also centered around ethical and legal concerns in medical practice, technological advancement, and artificial intelligence for healthcare service delivery in Nigeria, and how medical tourism will impact on Nigeria's healthcare system.
Beyond the code of conduct, beyond the professional code, are there laws? Or did the drafters of our laws, did they just leave medical doctors to continue to be practicing? I had all my children in public hospital because I was determined that is where I would have my children. But the treatment is something else. You go as early as 5. Those days of antenatal, you go, you take number, and then the nurses are strolling in like around 9. After that, they will take us through, we will dance. Then the doctors will not come until like 12 noon. And sometimes by 2, 3, the doctors will say, I've closed, I'm going, for those who are doctor patients. We do know that our constitution, which is our ground norm, provides that every Nigerian is entitled to his or her rights, to the right of life.
Before now, you can imagine that about 95% of children were dying of tuberculosis. Majority of them were unable to access good health care or have never come in contact with anything like vaccination or any form of drugs or treatment. As an MO or a house officer, you're doing your internship. For the first time, I understood that people that were coming to hospital for emergency were basically poor people. Emergency cases were basically poor. Malnutrition cases is only poor people. So you just discover that poverty and sickness, they work together. And it's select, why you are laughing? It selects a few people. No, see, there are kind of sickness that when you are oriented, you will not have.
Traditionally, Africa has been exporting patients abroad, and they spend easily over $5 to $7 billion sending patients abroad. And there have been newses and information about the problems in healthcare system of Africa. Now, most of the time when the Africa event happens all about how to send patients from Africa to other countries. But I'm great to see that my dear friend Usman and some of my international colleagues are supporting this event where Nigeria is trying to change that situation and trying to change a sustainable medical tourism development. Now, what is sustainable medical tourism, first of all? You see, if you keep on sending and draining the patient from the country, the $6 billion money is lost from the Africa. If you know, Africa is already a $35 billion healthcare industry, and there are already $65 billion shortage of healthcare expenses they have. And to be surprising, 79% of medicines in Africa are imported. So when you already have these challenges in your healthcare system, it becomes one more issue when you export the patient. Do I mean that medical tourism should stop completely from Africa? Of course not. Across the globe, Europe, India, Thailand, they do provide quality of care at a reasonable prices. So anyone needing the quality of healthcare, patient would still love to travel there. But I meant to say by sustainable is that in return of those $6 billion, the international organization should participate in the growth of African healthcare system. I have been updated with many great news that Nigeria has been doing great work in healthcare system, and they are putting up great efforts, and in fact there are certain free zones are coming in the healthcare system. I think so all these things are wonderful news where in more than 50 to 70% patient could retain in Africa for minor surgical procedures or up to tertiary level care and all, and only if for complex surgical process which is not available in Africa, patient can travel abroad. And only request from my side is to the global community and the policymakers in Africa is that even though when the patient travel abroad and when the money is spent from Africa to abroad, I think so the policymakers should seek some sort of relationship and exchange benefit from these international destinations.
The event also featured engaging panel discussions bordering on collaboration between healthcare service providers and medical tourism professionals in Nigeria.
And I want to go to the earlier recommendation you made, which is about creating a working group. That is a very good recommendation. They can come up with a framework to help achieve some of the challenges that are already existing with, first of all, the buy-in from government, the buy-in from the healthcare providers, and of course, create a platform and standardization for travel professionals. Take these products, create more products from them, and begin to churn the money. Because I see gold, I see money at the end of the day, in addition to providing the healthcare service, because it's about business, is it? Thank you.
Absolutely, absolutely. Couldn't have agreed more. I can see the passion that you're coming from. And I think that makes a big difference. I think collaboration is the key factor among various elements. Different elements have to come together, collaborate, and take it forward in terms of raising the awareness, create more education, as you rightly said. And then this builds an opportunity instead of just looking at it as this is not available or that's not available or not being negative about the situation. Identifying the opportunities and moving forward is a key factor. And I think this discussion right now is popping into the next aspect about, I think we will come to the last segment of our discussion. I would like to conclude with one particular question to all the panelists that I would like to take your inputs on, is starting from Dr. Prem, is public-private partnership. I'm sure Dr. Afzal gave another set of P's in the beginning in terms of perfection and privacy and pricing and all that. But this is another set of P's that we would like to discuss right now, is PPP, is public-private partnership, because that's what is boiling down to everything that we are discussing among all of us right now in the last almost an hour now. Is what do you think? What's your inputs on the PPP model that is critically required? Your few lines in terms of recommendation that we could offer to Nigeria in terms of developing the medical tourism industry for them. Over to you, Dr. Prem.
Yeah, so needless to say how important it is to go into PPP model. And in fact, we can add one more P, which is people. So public-private partnership with enhance, including people. You need all this even for the infrastructure development and to the access to advanced technology, which is happening. You need PPP model for even improving the cost effectiveness and quality and flexibility in so many areas which Africa at this moment require, which cannot happen, to be honestly, without PPP model. Why I say cannot happen without PPP model? Because the healthcare is traditionally resource consuming industry, and you need to understand that Africa is spending billions of dollars on healthcare right now. So if I talk with the current status of Africa, it's $35 billion which they are spending. And even if you add on $60 billion in healthcare in Africa, still they were not be able to reach to the quality which we see abroad. Also, if you talk about the pharmaceutical industry, 79% of medicines are still imported in Africa, right? So to overcome these challenges, I see only option is to go for more partnership models, be it a PPP model, be it more international joint venture models, where more organization needs to pitch in to support Africa, and more activities needs to, and forum like these needs to be created to enhance the value of each stakeholder for PPP model as well.
Where a medical personnel intentionally carries out an act that results into damage or injury to a patient, an act that is deliberate, perhaps with the intention of profiting from it, that is obviously a criminal matter, and such a medical personnel is liable to criminal prosecution at the High Court. Is liable to criminal prosecution, and upon conviction will be sentenced to either imprisonment, a sentence of imprisonment, life, or even execution. It depends on the magnitude of the offense, but so insofar as it is intentional, that renders such a personnel liable to criminal prosecution.
I want to emphasize or add to what my colleague has said. I remember when we talked about, the doctor had good intentions. Please, medical practitioners, the law will not look at your good intentions if no reasonable care was taken. So no matter how good your intentions are towards your patient, it's very important that reasonable care is taken. What is expected of you, somebody in your position, in that position to do? For instance, if another doctor should have come in, would the doctor have done what the doctor did? That is what the law will look at, no matter how good your heart is. So it's very important that we must be professional at all times.
Nigerian practical is different from theory and medical law and ethics. This patient might come, I can carry somebody's normal salary or somebody's drugs to save that person's life. It might be a keke driver that cannot purchase ceftriaxone. As a medical doctor, if they admit my father and say they need expensive antibiotic of Resofin, do you know I cannot be able to purchase it for 7 days? Do you know that it's drugs that is meropenem that is more than 25,000 naira per dose, 75,000 naira a day? So if that was needed for this particular patient and it's not done, this person would die. So the problem goes back to what I was saying, the medical healthcare negligence and poor policy. There should be universal healthcare coverage. And I was working towards that. Even if you charge, if MTN is 11 naira per minute, you make it 13 naira per minute, that each code 2 naira enters to the healthcare insurance fund. At least a patient, no matter where you come in, you can access healthcare, even if it's for 48 hours before relatives comes in.
And that's it on AV1 Express. Don't forget to join us same time next week for another interesting episode of the show. I'm Vivian Akinyosui. Bye-bye.